Good morning, good morning, good morning. I'm sure some of you are going to be watching this in the middle of the night. Hello, my dear ones. Man, are we busy. Listen, so many, putting together all kinds of things for you. That's what we're busy in. Working on finishing up the book. Patty is so busy she can't, she's just too busy. Patty's our A&P professor. She's teach med school. She's got so many classes to make and write, and I mean, she's one busy lady. That lady doesn't even have a TV. She reads and studies constantly, and it's like, careful! Books, you know, but when you get in that level, all kinds of things. Oh, can you please do a private video? I don't know, let's see. I want to talk about, remember this, I read, one of you guys wrote in and told me that you had an extreme amount of problems with peptide. Did you see what's on TV now? They have arrested the guy that is the CEO of this company that sells these peptides, and they were interviewing some people, and the tremendous side effects of supplementing your diet with peptides. And you know, the sales pitch, and this is one of the problems I was thinking about earlier that I hope you guys are really getting an understanding about, is don't believe anything. Don't even believe what I tell you. Try it and see. Some things you might not want to try and see, you know, because of the severe side effects of things. When you're dealing in proteins and peptides, which is part of the protein chains and all this, this is where you get into complex proteins, you get into complex amino acids, you get into more acidosis, and it just spawns everything off. And why someone would promote peptides as a youthful, giving you youth, these people are seriously sick. I mean, at best, they're going to be a major stimulant for a short period of time until everything starts falling apart. So you become keenly aware where all your weaknesses are. And particularly in the bowels. You know, burn your bowel walls up. Horrible. I mean, I just can't even believe that, you know, our natural health industry has become almost as corrupt as allopathy. I mean, it's just sick. People, they just are not thinking. And that's part of the problem, these companies. And I'm sure they probably innocent thinking. I don't know. But when you isolate chemistry out of the chemical world of the family of chemistry, you get yourself in trouble. It wasn't meant for man to isolate chemistry so much, potentize it, because it is then a beast of another color. And the amount of damage that this type of chemistry can do to someone, somebody, and some things is unbelievable. The acid side of chemistry is a big reality, and people have to learn what acids are and what they can do to you. What does cationic mean? These things like this, so you can understand that. Supplements like this. I personally left supplements 20 years ago or more. I was trying interleukin, 3D, 6D, 9D interleukin, all these sort of things like that. Yeah, right. And all my patients jumped up and said, I'm cured. Right. Yeah, spent a lot of money. And it's like, no, I'm not into spending a lot of money to get well, when all you have to do is shift your awareness to the incredible magic world of botanicals. I mean, you don't have to isolate chemistry and try to fight symptoms. That's when you get in trouble, and we've talked a lot about this. Treating symptoms is not the way to go. If you can't eat your health, remember the old Hippocratean? The medical doctors using Hippocrates, it just makes me want to throw up. One of the Hippocratean sayings is let your food be your medicine and your medicine be your food. That's what raw foods are. That's what herbs are. They're like, if you want to put it in that classification, medicinos, but they're how you get healthy. You get healthy through what you're consuming. And we are such aberrated now as Homo sapiens, we don't even know what species we are. When I say we're frugivores, everybody goes, what? Whoa, frugivores? You take I wish I brought that picture, but that was a cool picture. A guy chewing down on barbecue and then another guy sitting here eating a slice of watermelon. Oh, that was cute. Pat put that together. That's those two states of consciousness, and you can see them. The more spiritually aware you become, the more you can just watch these things and observe the difference in the states of consciousness of the people and their diets. Not to say you can't cheat once in a while. But the whole concept of treating symptoms, and the same thing with peptides or anything else, you have to be real careful. Why not just take arsenic? I could tell you arsenic is really good if you take it by, by an ounce a day or something. A couple dropperfuls of arsenic will take you down pretty far. I only had, I'm going to say, no more than a tenth of a dropperful, probably, or even less, of Peruvian bark, and that almost killed me. I went down bad. I will never forget, that was the worst experience in my entire life because I couldn't breathe anymore. I now know the difference between autonomic and central. When you can consciously have to make yourself breathe every breath, you become keenly aware. I mean, you go through panics, you go through all kinds of things. Because if you sit there, I would sit there and if I didn't remember to breathe, the autonomic was shut down. These neural toxins aren't worth it. And our society plays with neural toxins like they're candy. A lot of perfumes and colognes have neural toxicities involvements. I mean, it's just unreal. And therefore, we have a whole society of neurological problems. Horrible stuff. I wanted to answer this one, too, and I'm going to answer it through the same kind of way about symptomology, right? But this deals in a more of a spiritual subject. And this deals with emotions. And I just came out with that spiritual video, and this lady watched it. And she said, well, I didn't see any remedy. Let me see if I can read this. Hey, Natalie. And Natalie is Jason's counselor in California. So I just finished the spirituality course, and I'm definitely aware of the validity to what you said about trapped emotions and repeated patterns needing to be addressed. Okay, so trapped emotions and repeated patterns needing to be addressed. I don't feel like the course covered methods of how to evaluate these emotions and what they are coming from. So that tells me when that lady went through the course or guy went through the course, they didn't understand what we were saying. Okay, do you have any recommendation resources how I can dig into this a little bit further? I've said this on video after video. You cannot overcome your emotional chains through the emotional body. You cannot overcome your thoughts and your mind through your mental body. Take a look. Never works. You have to work from a more conscious point of view. You can't take an aberrated emotion and get rid of it through the emotional body because you're still playing in the worlds of duality. You're still playing in the worlds of karma. And it doesn't matter. It's all taking your attention. Oh, I've got to work on this emotion no, you don't. You got to go, see ya. Buddha brought in something very important to this planet, and that is what attachment breeds. Right? And so he finally, after sitting, 17 years or whatever it was under a tree or whatever, he finally got up and said, hell, I've had it. That's it. I'm good. I don't care anymore. I don't care anymore. When you put attention on your emotions, whether good or bad, when you put attention on your thoughts, good or bad, that's your change. Thoughts and emotions block your awareness, and especially when you're using them. It's the individual that's come to you, Natalie, that's using those emotions. They're feeding them. No one else is feeding them for them. They're feeding them themselves. And the whole idea of spirituality is to wake up from the emotional control that the emotional body, your astral body, has on you, and the control your mental body, your mind, has on you. You've allowed your mind to control you. You've allowed your emotions to control you. And you can't fix them by using the same body to fix them. And psychiatry, you can't use the mind to fix them. Half the psychiatrists need help. I don't know. As a health counselor, I've had a ton of psychiatrists, mental health workers, and things like that had the same problems that they're trying to fix people with. We're talking about a high level of understanding, guys. Most of this planet is into therapies and all kinds of things like that, but they're not into waking or breeding awareness. Because the awareness of the individual is the survival of the individual. Your survival is your awareness. Your mind will take you down the rabbit hole to Hellville. Your emotions will take you down the rabbit hole to Hellville. Nope. Detachment. I don't care. You want to get rid of emotions? I don't care anymore. You got to get to the point where you got to drop them, let them go. You can't drop your emotions with your emotional body. Your emotional body can't drop emotions. Your mind can't drop thoughts. That's what it does. The awareness of all of those things, are the only one that can go, talk to the hand. Consciousness isn't listening. So that's what I think some people maybe miss if they're thinking this way. This isn't a mental or emotional therapy session. That's not spirituality. That's where you get trapped even deeper. What do you replace one emotion with? Another emotion? Or another emotion? This emotion is better than this emotion, so get rid of these and replace them with these. Subtract one chain off and put on another. You can play in the emotion fields, have fun with it. But, emotions they're like thoughts. They can be your long road to waking upville, karmaville. Your emotions and thoughts is what keep you in creation. Once you learn to break those, you will start developing your ability to be beyond creation into the worlds of consciousness, into the worlds of the now, into totality. And that's a whole different level. And that's where I'm trying to move you guys. Let's get up here. And so that's the sort of thing, Natalie and this lady, I think it's a lady, I'm not sure. Let me see. Yeah, Stephanie. Yeah, Stephanie, you have to learn how to go, I don't care. I'm not going to allow my lower bodies, my material bodies, my embodiments to affect my awareness. Because that's their job, is to use your awareness, to run their machine. The astral worlds, they're all at one level. They're just machines. Emotional machines, thoughts. Thoughts are just like a computer system. You can't get anything in until you program it. It's the best AI you've ever seen. Where do you think the idea of AI came from? Yeah. The mind is, I mean, I probably couldn't say enough about it. It's amazing. But it's also your biggest trap. And it'll keep you in creation and spinning lifetime after lifetime after lifetime. So I've been trying to help you break those chains of thought. And the only way to break a chain of thinking is the chain of observation. You have to learn how to watch or observe without thought. Watch what your mind says about it, maybe, but be away from your mind and your thoughts. And it just takes some practice to do it. You used to walk around. I was telling you that time. I used to walk in malls just for all the colors and beauty because I was living in the woods. I needed to get a little social here. So I'd go into a mall and just walk around and look at the lights and look at all the beauty, see if I could read people's auras and see what they were thinking and stuff like that. You could only do that in the now when you're totally silent, mentally and emotionally, and your awareness is dominating the scene. And it's well worth playing with that level of spirituality because that's your survival. Health of the physical body, of course it's your survival while you're here for a very short period of time. If you live to be 100 years old, that's a grain of sand on the beach. You've been around a long time traveling. And if you don't believe me, ask your spiritual guide to show you your Akashic records. That'll make a believer out of you, I tell you. But that's really all I have to say about that, guys. You just can't win the game trying to go into some sort of therapy and overcome your emotional problems through emotions. You have to overcome through awareness. And it's not something you work out. These are just images. You have to simply turn your attention away from it. Take your energy out of it. You're the only one this individual is the only one that can help herself. You can have a therapist sit there and tell you what to do. That's like someone telling you how to eat healthy and be healthy, but until you strap it on, strap yourself in, start eating all the fruit and taking the herbs, you have no clue. You can watch others get well and people get out of wheelchairs and everything. Oh man, that's cool. But until you strap it on, strap yourself in, and you get on that Bronco and you ride it, you eat the fruit, you take the herbs, and you start relaxing and learning how to just watch things. Quit trying to create all these things in creation because you got to pay for them. And just have some fun for a while. Okay. I know I'm trying to hurry because I've got so much going on here, so I apologize for this. This is Kelly Locke. Ooh, Kelly Locke, I like the name. This concerns my baby, Imla. Oh my God, my baby. I'm afraid to read this. I'm afraid to read this. Oh my God. Oh God. My baby is being constantly monitored by the NHS in UK. Oh, God. Now you want to strap on my warrior suit. I'm ready to go, baby. I was thinking about that the other day. In the spiritual worlds, you have all kinds of spiritual beings. Masters, of course, and your spiritual guides. Gopal Das is a good example of a beautiful being. Long, beautiful blonde hair. A lot of people think he's Jesus, but he's not. He's Gopal Das. And amazing Eckmaster. But so many of them are just sweet, beautiful beings. But then there's the other ones. Now, I'll give an example for those that have read Rumi's poetry. Jonathan Rumi. All right. So Jonathan Rumi, what was he, a professor or something? But he wrote poetry, and what was he known for? Anybody know what Jonathan Rumi was known for? Well, I'll give you an example. Surrender is the order of the day. Surrendering is letting go of your emotions, letting go of your thoughts, That's true surrender. You're letting go. You're absorbing into the act. You're absorbing into the spirit. You're absorbing into God. You're absorbing into the omnipresence, omnipotent, and omniscient. That's what you're becoming. You are that. That's not something you have to do. You already are that. You're letting go, releasing, because you already are that which is. So it's not something you have to do or have to make yourself be. You already are that. That's how simple this is. It's just you just have to relax and learn how to become the observer. As the more you surrender, the more you become it. And what was I going to tell you? It'll come back. My baby has been constantly monitored, born 6 weeks premature. I am 44. Wow. Surprise pregnancy number 3. Wow. I'll have to tell you guys that for those of you females that are getting healthy in your 40s and 50s, be careful. Remember the lady from India that was 67 that got pregnant? Started feeling repulsed by all foods in early pregnancy apart from fruit. Looked into just living on fruits and found you. Well, that's pretty cool. I mean, when that comes intuitively, you know your masters or spiritual guides are working with you, and you must have a high being. You must have brought in this high being. Surprise pregnancy? Just want fruit? Come on, guys. She's bringing into this planet a big being. That's exciting, you know? Mm-hmm. And thank you for all you do. Well, thank you. Thank you. I had a great pregnancy, great quick natural birth, all while blocking attempts of hospital staff trying to administer steroids or take blood, etc. Isn't that sad? A hospital's a place of wellness, right? I mean, most of them are pretty good, I guess, but, they're medical, you know. I was talking to, over the weekend, a person that had a midwife and had a lot of midwife go along with her. I think you guys know her, Holly, the little red granddaughter of mine, real short Holly. Yeah, her second baby, midwife. Pretty cool stuff. I healed quickly, and it was interesting what the midwife had to do. She was 1 week late or 2 weeks late. And this midwife had a technique to go up in and open up that placenta. I mean, I couldn't believe this midwife. Smart midwife. Holy crap. I healed quickly, but baby born SIDS, 5 ounce, needed to stay in, 5 pounds, 5 ounces. Needed to stay in for sugars and phototherapy for jaundice. Ooh. Yeah, you're going to have to get into your young individual's lymphatic system for sure. Kidneys. I don't think there's too many children born today that we can't say have major kidney and adrenal issues. Pituitary is all over the place. All your endocrinology is all over the place. The nervous systems are down. You guys are seeing all this, so this is sad when these children have to come in with this. But you know what? We can get them better. We can get them better, right? After many bloods taken, one appointment at 5 weeks old, they took 7 vials. 7 vials? Freaking people. Of a little baby. Yeah, at once, and a week later, 4 more. They said jaundice was clearing, but she now needs calcium, vitamin D supplements. Here we go. You know what gets me? Vitamin D. They can't understand that your body is a living, breathing, adaptive entity. When you're in the sun, your vitamin D is going to go up. Why? Because you've got an acid hit to the skin. When you're in the side, you're not going to see your body increase vitamin D because you're under these friggin' crazy fluorescence and stuff. The body adapts and creates when it needs. And yet, the medical world is this staunch, constipated, You have to have everything perfect. You have to have everything whatever. You can't have herbs going into into your bloodstream as an IV therapy, but you sure can put chemo. I could just go in deeper and deeper into this and just aggravate myself to death. Better not. Rob, my oldest son, was 4 pounds, 1.5 ounces. They wouldn't let him leave the hospital till he was 5 pounds. Now I hear they let you leave the hospital even at 3 pounds or so, but I don't know. So her baby was 5 pounds, 5 ounces. All right. Now, calcium. What would you want to be looking at with your child? You would want, if I've got a new baby, I want to see the nervous system. I want to see the endocrinology. I want to see the kidneys, the lymphatic system, because if not, this baby, most of our children are headed down to Hellville. And when you have the medical world as about as ignorant as you can get when it comes to health, they're not about health. Remember that. Medical world will tell you they are about diseases. Then stay away from us. Stay away from our health field because you guys hurt people. Getting my grits going. That jaundice, though, I don't like that. So that just goes to show you, you've got some serious lymphatic problems in this child. I don't feel anything is wrong with her. She is strong, developing well physically and cognitively, just as my previous two did. Yeah, and you don't want the hospital to start hurting your babies either. I've seen that too. The vaccine syndrome and all that. Horrible. And these nurses don't know any better. But she was taken to intensive care for dextrose. What? All right, so we're into the adrenal glands. And of course, you got your kidneys right there. So you want to look at her adrenal glands. They're trying to give her a little sugar. That I would want to look at her blood work. I would demand the hospital. I don't know what the UK is like over there, but I want to see the blood work. Let's look at it. I don't know if I can read it in the way they make it, but let's look at the blood work. You want to see what's all going on here, not listen to them because what are they doing for the jaundice? You can just eat fruit and clean up the jaundice. What are they giving you for that, or the baby for that? And that stuff gets scary because there's not a pharmaceutical out there that does not have side effects. Then they insisted on antibiotics. What? Who are these people? Insisted on antibiotics for your baby? Even after I said no, said she could have been preterm due to me having a yeast infection. Okay. So they want to give her antibiotics because possibly you had a fungal or yeast infection, but they want to give you antibiotics for a whole different type of microbe. You give an antibiotic for fungal problems? No, you don't. Not and have the serious side effects that antibiotics have. These guys are nuts. That hospital is cuckoo, man. But when it comes to this sort of level, most of them are not very brilliant. So I relented and said had 2 doses in her first 2 days of life. What the hell? So now they want to kill whatever bacteria your little baby has in her lymph nodes. So she doesn't have, they want to start destroying her immune system right off. What the hell's wrong with you, UK? Destroy your babies? That's not very smart. So oh my God. She had 3 sessions, otherwise and she could have brain damage. Oh my God. Who is leading you down this road to Hellville? We can fix brain damage in infants. If you don't believe it, go to the Dr. Morse's .tv and go to testimonials and take a look at what happened to that young man and what we did to him. She is 20 weeks now, really strong, but they won't listen to me or really look at her, just reading blood results. Yeah, that's what they do. That's what they do. You're in a world, guys. That's the problem with the medical world, and they're creating people that don't want to even interface in their world anymore because it's become a very dangerous world. I interface it with kidney stones, and I am thankful. I love it. I use Sarasota Memorial Hospital, one of the better hospitals. You can get organic food. You can get all kinds of things. But on another level, they probably are real close to this. Most hospitals and all that, who knows? Oh God, when I refuse and ask to be discharged, the doctor threatens to contact social services. Well, move to America, guys. We're not that bad, not yet. Although they do the same thing, turn them over to social services. That's why I made that video. Take that video online, cram it up the you-know-what of that medical doctor, and say, why don't you sit down and learn something? I am breastfeeding. She is strong. Make sure your breast milk is alkaline. That's all I'm saying. I feel the NHS won't let her go and want to keep taking her blood. She is A negative blood. They want her to have the calcium and vitamin D supplements and keep blood checking her. I don't know what to do. You want to work on her endocrinology. You want to work on her parathyroid gland. I would get the endocrine gland formula. She's 20 weeks old, so you're talking about only about 4 drops. 1, 2, 3, 4. You're going to have to probably 20 weeks, somehow break her into some kind of fruit juice maybe to put that in since you're breastfeeding. But I would do that. Nerve power wouldn't be a bad one to do, a few drops. Kidney, a few drops. Can't go wrong with that. This is nutrition. These are not medicinos. I am breastfeeding strong. The brightest blue eyes. Yeah! I'm telling you, you probably have brought in here a big being. That's exciting to watch this. Things just don't happen for nothing. So suddenly here's a lady that just got pregnant out of nowhere, and then all this relating to, update 2 months later. Okay. The outreach department of the NHS will not discharge her. They have made an appointment for a consultation in November. The last consultation in November, the nurse was there ready to take bloods. She took another 3 vials after the doctor mentioned metabolic bone disease. Oh my God. You're going to have a problem. If they don't kill your baby, I hate to say that, but they do. Who is this doctor? This ego is so big, he doesn't understand metabolic bone disease. Really? All right, so you have to start looking at the endocrinology of your baby in all seriousness. And good luck with this. I don't even know what to say. I'd be moving out of the country. This is sick stuff. And we've got a sick world here. I keep telling you guys that. And when you have to interface your children in hospitals and stuff, you can get yourself in deep crap. That's why people are using midwiferys and having babies at home now. They don't want to interface anymore because of this kind of crap. They want to feed their baby healthy. This doctor has no idea that your baby is a frugivore. No idea. He has no idea what he's saying here would relate to the endocrinology of that baby. At 20 weeks, he's saying all this at 20 weeks. Yeah, but I need a drink. You guys got anything out there, alcohol or anything? I just drink my water. I know this frustrates me like nobody's business because these doctors are know-it-alls that know nothing. Oh, they know it all and they're going to help your baby. You don't know anything. You're just a mom. Oh, I can't stand these kind of people. They're the worst kind of humans on the planet. No offense, but you got my bowels going now. You got my grits going. And when you get medical doctors this ignorant, let's just say you had calcium problems, you have a bone density problems. How are you going to fix it? Everything is fixable, medical doctors, because you don't know what causes anything. You can't fix anything. When you don't know what causes it, how do you fix it? Ignorant. I'd be careful with this doctor. I don't know if you got lawyers over there that can sue these people. Get a hold of a really good lawyer, and maybe give a doctor a little kiss on the cheek. I mean, this is sickening. I don't know. See, I knew I didn't want to read this. What? Lols. Okay, you already were there at the house. The nurse called 10 days after she mentioned Great Ormond Street Hospital and endocrinologist, but it was a hurried call, and she said the doctor would call about this, but he didn't. Yeah. At the end of every month, they request more blood tests. So I sent a SAP at the end of May, a subject access request for all of her blood requests and subsequent results. They haven't responded to that either. Boy, I'd get a good attorney and I'd start pulling all this paperwork in. You can send it to a good medical doctor, find a good health medical doctor in the UK if there is one, or send whatever you can over here. We'll look at it. I asked my GP for her medical records because we want a second opinion with a non-NHS doctor. Yeah! Right? When Emily's record came through, they had listed hypoglycemia on the 5th of January alongside jaundice and suspected sepsis, but haven't listed hypoglycemia. I looked again. Well, that's why the dextrose. But again, go to her adrenal glands. And that's just a heads up that she has adrenal gland problems. Well, that's your kidneys, that's your lymphatic system, but it's also your blood sugars, but it's also your her female gonadals. It's also her mineral metabolism. I mean, there's all kinds of things the adrenals do that she can have trouble with. Oh, but they're going to go after each one of these individually, and that's how they hurt you. Instead of going and fixing the adrenal glands, which fixes everything, they tear it apart, and then they don't have that ability. I'll be surprised if an endocrinologist has that ability. I mean, that's how sick this field is. No offense. If you want to come on my show as a medical doctor and tell us that I'm screwed up and wrong, you're welcome. I looked again at our hospital stay discharge letter and asked the GP secretary to look at it on her computer while we were on a telephone call. She could also see there were no record on the 5th January on our discharge papers to suggest hypoglycemia. Ooh, you've got some corruption going on in this hospital. Whoa! You need a lawyer. You need to get an attorney. You're a smart woman, and I would keep going like you're going, because you might be able to trap them and take care of some business here and get you a little pocket money going, because this is insane. These people, that's why I do this, although I get my bowels in it up for today. Yeah. Sorry about that. Marco, you might have to cut this whole video out. She thanked me for highlighting the error and said the wrong code must have been listed. They then removed the listing for hypoglycemia on her medical record. Now we are unsure what came first, the wrong code listed for hypoglycemia, or they listed the condition afterwards to treat an ongoing concern. I would get me a good attorney and make that doctor and those nurses know that you're done taking their crap. And this hospital, you're done with their corruption and crap. You want someone that has some ethics. You want someone that converses with their patients, because over here, it's the patient's code of ethics that the doctor must. And if not, you can take care of business. There are state boards and stuff that you can go to handle this. But your doctor has to treat you, so does the hospital. Because remember, patient isn't the word. Remember what the head of the American Medical Association said when asked how normal, simple humans protect themselves from medical doctors that hurt or kill too many people? And the head of the Medical Association said, let buyer beware. That sounds like a situation here. These guys don't know what they're doing. And, not good if they start putting some false information in there. That could be, over here, a very suable offense. Wow. All right. What we did see, and I researched them, was the two different antibiotics given, were whatever, benzopenicillin, sulfa drugs, of course. And the second one was gentamicin. Although they said at the time it was a course. I don't know what the second antibiotic given intravenously is a strong one used to treat sepsis. She didn't have sepsis. The day after they gave her gentamicin, her blood culture results came back clear. And after that, they put her under the phototherapy lamp. Boy, this is just how the medical world harms and kills people. This is just how they do it. And it's a good example of how they can harm your babies or you. Remember the lady, a lady called me up. Her husband was a patient of mine. He was a cancer guy, I think. I can't remember what he had, but he was done. We cleaned him up and everything. But when you go on these programs, if you have genetic adrenal weaknesses, you're going to reach some fatigue in there. And it's not the program. You're on all the energy foods, all the good stuff, all the tonics and stuff. No, it is the genetic past. And I told you, this is how you get it. And you'll go back to the genetic past when you start hydrating and detoxing. And you'll feel tired. And you go, why am I feeling so tired? I'm doing everything right. No, this is how it works. They have no clue of how the body works. I haven't ever talked to a medical doctor that I could actually sit down and have a decent conversation with about the body that understood anything about it that I thought was worthwhile. No offense, no ego involved, but it's like, are you serious? I mean, some of this stuff is crazy stuff, and you right here, you're hearing it. But it's just on and on and on. So this lady took, this gentleman checked himself into the ER. Generally, I like ERs. You go in, an ER doc, I got a little this or that, fix you up here, that sort of thing. Now it's a little different. Now we're going to try to find something to admit you, because there comes the money. I'm telling you, they try to admit you around here as much as they can. You got to be careful with it. And but they did. They admitted him, and they got a blood sample and a urinalysis. Remember that one? His urine was so cloudy that because he was filtering, they freaked. Ran him to either critical care or intensive care. Put him on vancomycin. His wife calls me while all this is happening. She's crying and freaking out. She says this is her. They're going to kill my husband. 1 to 2 hours later, I got a call back from her. She said, they just killed my husband. So you got to beware. You can't trust these people. You've got to be aware. I don't even ask you to trust me. Listen to our testimonials. Listen to other people. Watch our successes, stuff like that. Make sure you understand what I'm talking about when I say the lymphatic system, acids and base. Understand how all that works, and you'll never have a medical doctor lie to you again. I wonder, could this strong antibiotic be the reason she's suffering prolonged jaundice? Could be. Because remember, it shuts down your immune system. Let's see. What's your immune system? I forgot. Yes, the lymphatic system. And if you want to clean all that inflammation, acidosis, out of the walls of the liver, you've got to clean your GI tract with it. And you want to take a look at her pancreas as well, because that's right across the street. I'm dead serious about this. If she's got jaundice right now and she's a little baby, she's got some problems lymphatically. That's how you see jaundice. That's how you see anything in the body. Remember, all your liver is a bunch of cells in what? Blood and lymph. That's some chemistry in there, of course. But when you look at the basics, your liver is just a bunch of cells that form the liver and their specific functions. And then you have blood to feed the cells and lymph to remove the waste from them. That's simple. When you don't remove the waste from the liver, what do you see? Hepatitis, you see fatty livers, jaundice, it goes on and on and on. All very, very fixable. The liver is an incredible organ that loves to rebuild itself, even almost on an acid. I don't know. I remember when I was pregnant, they called. Now here's the thing that you might consider, sweetie. Your lymphatic system. Why does your baby have these problems? It came from you. And that's one of the problems having children older, is if you're not into health, and even if you are, I've been into health all my life, and as soon as I hit 70, I can feel the difference. I can't go out and pick up a railroad tie anymore. I used to pick up a 200-pound railroad tie easy. I can't pick them up anymore. I can pick one end up. But these haven't gone away too much, but still, you change. There's no question about it. What? Lols, I already got your stuff. We're building fences. Yeah, we're back to building another long fence. So I had concrete delivered, 6x6, 12-footers, and we're out digging this morning. I got a kid out there digging right now. Yeah, nutcase. Well, that's how I can work off my energy, because when I hear stuff like this, guys, I'm sorry, but I love you guys. And when I see these individuals, and they're pompous, arrogant, and what they can do, taking your baby and hurting them with all these high-level antibiotics. These aren't candy. These antibiotics, vancomycin is not candy. Killed her husband within an hour or 2 hours. Killed him dead. Now, if I'm her, I'm going to majorly sue that hospital. I'm going to walk away a millionaire. That was ridiculous. But they freaked out because the urine was full of sediment. And they think that means you have an infection. They have a long way to grow. And because of that, how many people have they hurt? Antibiotics are not candy. They all have gnarly. Look at Cipro. Cipro causes blood clots. I had a patient, a paraplegic, who his wife called me up and said, hey, my husband is in the ER. He just had 4 blood clots and a heart attack. What did you do to him? I said, our program doesn't create blood clots. It breaks them apart. That's not something we did. But I'm taking it on. I'm taking all that on. Okay. All right. I said, as soon as he gets out, I went down and visited him in the ER, in ICU. And I said, I have no clue. Maybe it broke some clots loose. Because, that's kind of what you're thinking would be. That's the only thing I could come up with, that he already had blood clots and it broke them loose. So I said, when you get out of here, come in and see me. We'll talk about it. So he came in. He's in a wheelchair. And I'm talking to him. And his wife's sitting there, and I said, I have no clue. I said, this sounds something like an antibiotic would do. And when I saw his wife look over at him like that, I said, what did you do? He said, I got a little bit of what was it? A little bit of a kidney infection or whatever. I said, no, that's me pulling it out. He said, well, my medical doctor put me on Cipro. I said, Cipro? Oh, no. So I brought the big PDR book out and I said, read this. Cipro causes blood clots, strokes, and heart attacks. Famous for it. And they still pass it out like candy in hospitals. You tell me. Matter of fact, my urologist recommended Cipro for me. Of course, I don't take antibiotics, but he recommended it for me. And I said, do you have any idea what you just recommended? I said, pull your PDR out. They pulled the PDR out and looked it up. He said, oh, my God. That was my medical doctor. Oh, my God. We have to take your health in your own hands and be aware that you have a whole world out there trying to grab your child and hurt them. For some reason, I don't know, the negative forces, and these medical people have aligned themselves with this. It doesn't seem like they get out of this trap that they're in. So I don't know what to say. And high calcium in the blood that they are monitoring as the labeled condition. That's why they're saying this is because of the high calcium in your blood. The problem is she's not utilizing it. That's her endocrinology. He did mention, didn't your medical doctor mention getting an endocrinologist? Well, for your sake, ask them what's the job of the thyroid and parathyroid. They think the thyroid, but it is the parathyroid that actually is responsible for putting calcium right in bone matrix and things like this. So you got to tell them that that's my baby's parathyroid and thyroid. My question is, how's her pituitary? How's mama's pituitary? How tall is mom? See what I'm saying, guys? You want to look at all this because they interpret things at a whole nother level that's dangerous. So they're willing to take a baby like this. We could come in and fix this baby up like this. They're going to prolong this and run this out until, something really happens or something. Okay, I remember when I was pregnant, they called to say some results had come back that the baby was high risk for Down syndrome. I refused the extra test they wanted to do ongoing and continued enjoying my pregnancy. Yeah, you know what? Always go for health. Because no matter what the karmatic and the conditions are in the tissues, you're on the road to rebuilding them. You're on the road to rebuilding yourself and your baby's bodies. And you have, 3 other children, you said, or something like that? So what about them? We are all, on my side, I hope, on the road to Wellville. And you have to really be careful with the medical world, and especially around your children. Through the years, you guys seen these kids being taken by all these states' cases like this. These judges are as ignorant as any basic attorney out of school. They have no idea what common law is. They have no idea the rights of the individual, the parents, and your rights. They have no idea. And I'm trying to get my friend to do a course for our school on this, because you have a lot more rights in America than you even begin to realize. They've lied to you and lied to you and lied to you. Our legal system is corrupt as you can get. It sounds like the UK is not too far behind us. God dang, man. In comparison to my previous pregnancies 7 and 11 years ago, the NHS has been very encroaching this time. Are you kidding? That's because they're going by the stats. They think that your baby has systemic sepsis. That can kill a person. They see that he has a low blood sugar. They might want to call it hypoglycemia. They didn't list it. Why did they give him dextrose? If they didn't list hypoglycemia, then why did they give him dextrose for? If he didn't have low blood sugar, why would you give someone dextrose? See, I don't. I like the fact that you're getting all the reports and reading them. I love that. Blood works and all this other stuff. And it's about what you have to do is to monitor your own worlds. I mean, it's too bad. They just frown and shake their heads when I said no to test. You know what? Get that video offline and send it to them and say, read this, watch this, and if you can have any way you can come against that and say something different, you're well welcome. Let's see, in chemistry or physics, you prove me wrong. All right. Oh, looky here. Look how pretty. Look at how beautiful those eyes are. Look at that. Look at that. Look at those eyes. Look at that skin ring, skin ring, skin ring. So we know, look at the lymph. She's got a lot of white in her eyes, honey. She's got a lot of lymphatic problems. Look at the skin ring. Thyroid. Well, thyroid, that takes you right to thyroid. Parathyroid takes you right to bone matrix. Tell them that. If they disagree, go choke a dog. They haven't been in the world as long as I have. I'm sure your medical doctor hasn't been a medical doctor for 54 years like I've been a naturopath and biochemist. I'm pretty sure of that. I'm pretty sure in his practice. He's got a little red skin, though. Not bad, but this picture shows a little red. But look at these eyes, guys. Let's see what I can see. Well, you see the skin. I believe I see nerve rings. I'm not sure. Don't get freaked out yet. The bowels need to be worked on. She's got ballooning a little bit around. And here's another area that, well, I'm just going to throw it out there. Spleen. You want to take a look. She looks at her platelets, her red blood cells, white blood cells, WBCs, RBCs, things like that. You want to make sure her platelets, her white blood cells are within the normal ranges, because it looks like, but that's all I can tell because I can't see well, possible only, honey. But I can tell you one thing, she's got a lot of lymphatic problems. Her eyes are white, not blue. And skin, she has a big skin ring. So again, when you have a skin ring, what do you say? Thyroid, parathyroid. So I bet her basal temperatures are low as well. But that's not something they're going to. I tell you what, I don't know. There's a whole other page to this, so I don't know. I want to thank you for your videos, and thanks. They confirm fruits are the way after Emily. We are frugivores, and there's not a medical doctor on this planet that can argue anything but that, because in a field that's not theirs, where you have some of the greatest minds, anthropology. I mean, Dr. Walker created a microscope beyond anything Rife or anybody did. Who can do that without a brain? So there's not a medical doctor on this planet that can tell you that humans are not frugivores, because they'd be lying. We're frugivores, so fruit is the number one food, and especially neurologically speaking. Also for sepsis or any type of jaundice. Of course, you want to get fruit, open up, clean, astringent, clean, get the kidneys filtering. Oh, God forbid they check her urine and she's filtering. Whoa! Then you want to cram my videos up their butt, because they can hurt you. Remember this lady's husband. Sickening. Much love to you, honey. Listen, I'm here to help you in any way you can. When you're in another country, I don't know what to say about it. Right now, the UK, and all you guys know this, and I don't mean to be anything, but I haven't heard anything good coming out of the UK. And it's like, what's going on with you guys over there? You know, all you beautiful people have to put up with these, but we have the same problem, except right now, we don't have in my opinion, we don't have a bad president. But we could, look at what happened to Spain. They just had how many thousands of immigrants coming out of Africa, because they're getting slaughtered in Africa. So instead of all of us helping Africa get rid of the people that are slaughtering them, you know what? We just let them get slaughtered. I mean, if you want a world order, then you got to have a spiritual world order. You can't have a greedy world order like you got. You can't have the Rockefellers, the Rothschilds, the Warburgs, all these kind of people running it, because all they want is your money and you dead. Remember, we're overpopulated? Hugely so. Didn't you read the tenets of the world order? We got, 9 billion people on the planet right now, and they feel that there should only be 500 million? You can read these now. They're open about it now. The world order doesn't hide anymore. They used to kill you if you opened your mouth. I know people that were actually executed because they brought up the Trilateral Commission. They brought up the Club of Rome. Same thing. This is where the same people involved in some way in these vaccines, especially in the COVID vaccines and the slaughter of humans on the planet. I mean, you've got to look at these things and realize that these leaders are mostly corrupt and sick. And so somehow people have got to gain control of their countries back and their world back. And I don't know, whether that's going to happen or whether you just let this world go down. Because remember, it's just creation, it's just materiality. This is just a material body, comes and goes. The nurse booking in this pregnancy was recovering from illness herself and was shocked I wasn't on medication at my age or suffered from illness. At 44? I'm 76, hurrying around to 77, and I've only had kidney stones. That's my thing. But I go back to the earlier days of growing up with all the dairy and the sweet teas and all that other stuff. So I'm getting them. I'm getting them mostly out now. But, you keep your kidneys filtering. You keep your lymphatic system moving. You don't worry about tumors. You don't have to worry about anything like that. You don't have to worry about pain, things like that. That's, she was surprised she wasn't on medication, or that I haven't used the doctor's surgery for myself or my children since they were babies. Surgery? I don't know. People must be sick over in the UK if everybody thinks that. But anyway, didn't mean to take up so much time, but this does. One last look. Cutie, cutie pie. Yep. I'm all in for healthy babies and everything else. You guys know that. And when I see these hospitals and things like this living in a world far, far away, enough is enough is enough is enough. And this guy sounds like Jack Stupid. I mean, when you see excessive calcium in the blood, where's your first thought? Of course, they don't know anything about skin rings or anything like that, but they could check the baby's basal temperatures and look at the thyroid and stuff like that. Absolutely. That's where I would be going. How come the body isn't utilizing the calcium that's in the blood? Why isn't it? Well, you need a hormone for that. Oh, you do? Oh, well, what parathyroid? Oh, those things. I was told they weren't worth anything. I'm going to have to go here in a minute. You guys got my bowels going now. Get out on the road. I'm going to go. Where can I go 100, 200 miles an hour around here? I never drive fast. I'm not a fast driver. My son is. Some of the guys here in shipping and stuff, they love to get on those bikes and 120, 130, 140 down the freeway. Not me. I was driving down the freeway the other day, and I was probably going 80. And I saw this biker pull up beside me and looked over, gave me a nod, right? He's looking around, looking back to see if there's any cops. Wow! At 80 miles an hour, he jacked that thing up and went on. And I was just thinking, man, I might see him down the road, laying on the road somewhere, or at least the body parts. But he did, made it. Okay, this is this is from Lithuania, and I apologize. I'm just an old country boy. The name is Edgaras. Edgaras. 26 years young though. 5'11", 172 pounds. Anxiety, depression, ADHD, and inflammation. Okay, so here's a young man, 26 years old, that has adrenal and kidney weaknesses, right? The minute you say anxiety, you can also tie that a little to O2 saturation of the body and breathing. And you're going to go right into your autonomic nervous system. And that's going to take you into the stomach and GI tract. And it's also going to take you back to the adrenal glands and the kidneys. So that's where you're going to look. You're going to look. Most people have chronic GI tract. Well, this is the autonomic brain right here. This is the CNS. This is not the autonomic brain. This is the autonomic brain and tied with the adrenal glands. That's how you get your neurotransmitters. That's why when your top systolic blood pressure is down low, that means you have low neurotransmitters out of the adrenal glands. And the lower they go, the more possibility you start to see nerve rings in your eyes. And pretty soon when you're at 80, 90, 100 over, you're like, well, man, I don't have any energy. I can't sit in school and listen to the teacher. A lot of these children are like that. No one's thinking about them. But anxiety is your adrenal gland, son. Depression is parathyroid. So he doesn't have, he's 5'11", so there's not enough there height-wise to go, oh, pituitary. But what does the eyes show? Do we have eyes? Oh, we good? Oh, what was I thinking? Nerve ring city. Look at that. Look at the nerve ring, son. God dang. You see all that brown around your pupil? That's chronic lymph. That dark brown is very chronic lymph. I'm not going to get myself in trouble, but I can tell you what. If you haven't got a blue eye, your eye is very light brown. If you look in these nerve rings, sometimes I always can't tell. Light brown, but you got some hints of blue around here. I don't know. Brown eyes don't never look like this. This generally is a blue eye in subacute and chronic lymphatic stages. Look at the skin ring. So this is the right eye. Are we going to see, parathyroid, thyroid area? Absolutely. Pituitary, absolutely. Look at that pituitary. Chronic lymph involvement in that pituitary. And pineal gland. What do we got over here? Look at the nerve rings, even in the brain. Malabsorption ring, skin ring. Although your cells don't look too bad, man. You don't look too bad. But you got to work on your endocrinology. Yep. You're showing pituitary weakness on the right side. Definitely pituitary involvement, pineal gland involvement. So all your endos could use up. And that's basically why you're seeing what you're seeing. But you got a lot of nerve rings, son. So you have a lot of adrenals. You could have major anxieties, phobias, and all kinds of stuff. Having that many nerve rings, that means your myelin sheath. So your adrenal glands are in a chronic state of weakness, and you want to work on them. You can work on them with herbs or use a glandular to help too. So it's up to you, but I definitely would use the endocrine gland formula. You've got some endocrine gland problems. And of course, the kidneys are coming right into play there. ADHD, yeah, you just got a ton of nerve rings. And that means that when someone that has these amount of nerve rings and stuff, they somehow inject neurotoxins either through breathing, eating, or medical, you can go down with them pretty bad. It can throw you into ADHD, and you probably got that through vaccines or something, because you can't vaccinate someone that has all these nerve rings and not expect to have some serious neurological side effects from it. I mean, especially if they're using thimerosal, you're going to come out with something. And this is the sick part of this, because what are you trying to do? ward off disease that doesn't exist. All you got to do is clean your body out and your sewer system out of your body, and then you don't have to worry about a thing. You don't have to worry about tumors. You don't have to worry about what they call cancer. You don't have to worry about any of those things because you are not creating those. Your body's not creating those because you took care of how the body ends up creating these things. Not because the body wants to. Inflammation is just acidosis. So it's just saying you're systemically acidic. And that's just what your eyes are showing. But you're also very weak neurologically and everything else. We need to build that up. You don't want to stay that weak like that. I have sensitive nervous system. Yeah, you do have a sensitive nervous system, son. You do. Let me give you a hug. Come on. It's good. You'll be okay. You'll be okay. You just now know you got to work on it. And between the herbs and the glandulars, that's all really that you could take as a supplement. Everything else, you got to be real careful with that. They don't let me use borage even. Inflammation on my teeth and inside my upper jaw. Well, this is where you're going to get abscesses, lose your teeth, lose your bone, lose your gum. That's just all lymphatic stuff. But look at that chronic brown around your bowels, right? That chronic brown around your bowels, that's chronic lymph. That's chronic lymph. I've been working in the garden. Don't look at my fingernails. I was out there working in the morning, early morning this morning. Like I say, we're putting up some fencing, so. Titanium, which holds stronger for my bones after injury. Oh, wow, he has a titanium, something with the jaw, huh? Injury. I am interested in explaining what you can see from my eyes and how I can help myself to be more stable and function to my full potential without a kind of drugs. Sounds like a good young man right here. Yeah, I don't blame you, son. I tell you, we're here to help you. Right now, using medication for anxiety. Yeah, I can see why. I wouldn't use medication for that. I would definitely use adrenal. We have adrenal formula just for the adrenals. I would double dip it. Or get an adrenal glandular and the endocrine gland. But you got to work on your pituitary and your other endocrine gland. Your pituitary controls the adrenals. Your pituitary controls the thyroid, parathyroid, and you have a large skin ring. And what I would worry about is the bones and your connective tissue. We don't want to see problems like that. Let me see. Well, you have minor prolapsing, although down by the sigmoid flexure, down at the distal end of the descending, yeah, you've got some like a spastic area. But you're starting with those radius solaris, like in the right side, up through the mid-lobe of your right lung. You've got some chronic bronchi there feeding into that lung. You've got a chronic feed up into the mastoid ear area, also up above the cerebellum. Yeah, that right kidney is a little chronic. Left kidney not as bad. You're better on the back of the head on the left side. But look how small your pupils are. Your pupils are so small, and that's what you said, inflammation. Your pupils are so small, and it's showing that you're systemically acidic, and you're feeling that. Well, that's because your kidneys are not filtering. Well, why would they? Your adrenal glands are pretty much going, I've had it. I've had it. I'm tired. And I can see why you're suffering. Your endocrinology is vital that you work on, and your lymphatic system. And then you will get into your 30s and 40s and dance the night away. All right, guys. I don't want to. You already got me going with this. I better cool off somewhere. I love you guys. I always try to protect you guys as much as possible because this world there's a lot of negative, evil things. There's the beauty of this world, and like I said, there's the duality on the other side. As beautiful as you wanted to see and live on the spiritual side, you can't ignore the other side. A spiritual person isn't one that just made themselves fall in love with them and all that. They're awake and aware. They know. They're full of knowingness. And that's the beauty of these masters. You look at them, all you see is divine love. Not for you, for everything. For the one thing that I love about a true master is their love of God. They have totally become that which is. And that's what you see emanating from them. But and working in the lower worlds, they still have their individual bodies. And some of them are pretty powerful. There's a female master, Katadaki. Let's just say, she's a strong lady. Love you guys. I will see you on the next video. This is Friday. And I'm going to be working the weekend doing some concrete work and stuff like that. Nah, I'm going to let my son do it. I love you guys.